Hi everyone, you're watching Health Pioneer and I'm Dr. Aastha Visen. So today I'm going to briefly touch upon the topic of fatty liver disease. Now it is so common today that almost 2 billion people worldwide are dealing with this condition. But many of us are not aware of what actually fatty liver disease is. What are those terms that we keep hearing? What is alcoholic fatty liver disease? What is non-alcoholic fatty liver disease? What is this term that we call as NASH? And what is the ultimate cure for this? Are you aware that 2 billion people in the world are facing this condition, but there's currently no treatment in medical science for it? Are you aware of the latest research that is proving to be hopeful for this part of the population? Do you think it can provide the ultimate cure for fatty liver disease? Watch the video to find out. We'll be discussing about fatty liver disease in detail in my later videos, so you can stay tuned for those. And there I will be discussing about some of the symptoms that are associated with fatty liver disease and what are some of the preventative and treatment options that are currently available in medical science regarding this condition. However, for the purposes of this particular video, I just want to briefly mention what fatty liver is. So in its basic terms, fatty liver just means fat accumulation inside the liver. Now, naturally, all vital organs have some level of fat deposition, but when it comes to talking about liver, the general guideline is that if the fat deposition is more than 5%, we term it as being a fatty liver. Now, in its initial stages, fatty liver is asymptomatic, so you can go for months and years without knowing you have fatty liver. It is only gradually that you start developing certain symptoms that are related with severe liver disease, which can also cause other health related problems. Now, what are certain risk factors that are associated with fatty liver disease? So, the topmost is obesity and diabetes, which is not surprising at all. Then there is some dietary habits. So you're taking increased refined carbohydrates, or you're having sugary beverages, or even a compromised gut health system is a risk factor for the development of fatty liver disease. Fatty liver disease can be divided into alcoholic fatty liver disease and non-alcoholic fatty liver disease. So in alcoholic fatty liver disease, what's happening is excessive consumption of alcohol is very rapidly leading to fatty liver disease. So rapidly here means in a matter of few days only. So remember, alcoholic fatty liver disease is the very initial step. It is the very first step. So you're going to be very asymptomatic at this stage. You would not know that you've just developed a fatty liver. So this stage is completely reversible given that you have stopped taking alcohol for at least 2 to 3 weeks. But if that has not happened, then alcoholic fatty liver disease moves on to becoming alcoholic hepatitis, which is the next stage. Now, in this condition, what happens is hepatitis occurs. So, hepatitis is the inflammation of the liver. Now, obviously, if there is inflammation, you're going to start developing symptoms. So, you're going to have some sort of dull, achy pain, or you're going to start feeling full on the upper right side of your abdomen or the center of your abdomen. This stage is again reversible if the necessary precautions are taken in time. However, if not, then this stage moves on to becoming liver cirrhosis, which is the end stage. Now, this stage is completely non reversible, meaning cirrhosis is where permanent damage has occurred to the liver tissue. It has become dead, it has become non functional. So, the only treatment option available at that point is to stop the liver from undergoing further damage. That was alcoholic fatty liver disease. Now, what is non-alcoholic fatty liver disease? So, non-alcoholic fatty liver disease, or NAFLD in short, is basically fat accumulation in the liver without excessive alcohol intake. So, in this condition, basically the metabolic diseases are playing a bigger role. So, metabolic conditions like insulin resistance or the development of diabetes, obesity, having high cholesterol, or even conditions like polycystic ovary syndrome and hypothyroidism actually increase the chances of the development of NAFLD. Now again, NAFLD is the very first step, the initial step, which can be asymptomatic completely. Also, it is reversible at this stage given that you have taken necessary actions such as lifestyle modifications or changed your eating habits. So at this stage, it is completely reversible. But if current steps are not taken, then it moves on to the next step, which is called the non-alcoholic steatohepatitis, or NASH in short. So steato means fat and hepatitis means inflammation of the liver. So basically what NASH is inflammation of the liver caused by excessive fat accumulation. Now, this condition is also completely reversible if the necessary precautions are taken, if the necessary steps are taken. However, if not, it then moves on to the third and the final stage, which is again liver cirrhosis. So, again, when the liver is cirrhotic, there's nothing much that can be done. The only thing that we can do is prevent the liver from having further damage at this point in time. Reiterate, fatty liver disease can be subdivided into alcoholic fatty liver disease and non-alcoholic fatty liver disease. Alcoholic fatty liver disease is the initial step, which then moves on to becoming alcoholic hepatitis, which moves on to becoming liver cirrhosis if the condition is left untreated. Similarly, non-alcoholic fatty liver disease, or NAFLD, is the very initial stage. It goes on to becoming NASH if left untreated, which then moves on to becoming liver cirrhosis again if left untreated. Now, what are some of the symptoms associated with fatty liver disease? So, remember, in its very initial stages, it does not present with any symptoms at all. It is only gradually over time that you might start having certain symptoms, and it will start with very mild versions moving on to becoming more severe. So what are some of the milder symptoms that you may develop? So that is just dull, achy, slight pain or fullness in your upper right quadrant of the abdomen or the center of the abdomen. Or if you're running through certain blood tests, you might accidentally notice that your liver enzymes are running high, so your AST and ALT levels will be high. Now, when the condition moves on to becoming more severe, you will start developing loss of appetite, or you will feel less hungry. You might have episodes of nausea and vomiting. The nature of the pain is going to become more severe. You might start having yellowness of your skin and your eyes, which is called jaundice in medical terms. And moving on to even more severe condition, or at the end stage point when the liver is moving towards cirrhosis, you might start having fluid accumulation in the abdomen, which is very closely associated with kidney failure. Your risk factor, your chances of developing liver cancer is extremely high at this point as well. And remember that liver is the organ that is supposed to detoxify our body. So if the liver is not functional at this stage, all the toxins are able to move towards the brain. Some treatment options available for fatty liver disease. Unfortunately, there is still no cure for fatty liver disease in medical science as of right now. The only thing that can be done is minimize the symptoms or the discomfort that comes along with having fatty liver disease. So things like making lifestyle changes or eating healthy is the only option that's available. So you can try to lose weight, you can incorporate a nutritious diet, low fat diet, and try to minimize your risks of developing chronic medical conditions, especially diabetes and high blood pressure. As of current times, the FDA, or the Food and Drug Administration of USA, has not approved of any treatment for fatty liver disease. So if in current times the FDA has not approved of any drug treatment for fatty liver disease, what are some of the options available if we wish to cure this condition? That is where the latest research comes into play. So a very first of its kind drug has been developed recently by a group of scientists at University of California. It has been reported that this drug safely and effectively inhibits a key enzyme that stops the progression or even the development of non-alcoholic fatty liver disease. So basically this drug, called Ionis DG82RX, inhibits an enzyme in the liver that is responsible for synthesizing triglycerides. So if this enzyme is inhibited, you basically are inhibiting the development of fat inside the liver. Basically, the aim of this study was to check the tolerability, safety, and efficacy of this new drug compared to the placebo in terms of reducing liver fat in patients that were already diabetic and were already dealing with an NAFLD. So basically, the study was 13-week long in which 44 participants were chosen. So these 44 people were divided into two groups. One group was of 29 people that were to be administered the drug, and then the other was 15 people that were to receive the placebo. Now, the patients that were chosen were between the age of 18 and 75. Their HbA1c was between 7.3 to 9.5. Their BMI was between 27 to 39, and the total percentage of fat present in their liver was more than 10%. So these were the categories that they needed to be fit into. So the treatment group was given once weekly dose of 250 milligrams of Ionis DG82 RX. What were the findings of this study at the end of 13 weeks? So the results showed that there was significant reduction in liver fat. So roughly 30% of liver fat was reduced based on the MRI findings, and that was without causing any abnormalities in blood lipid levels, blood sugar levels, or causing an abnormal increase in the liver enzymes. Also, no side effects were noted in the gastrointestinal health or the GI system, and there were no abnormalities related to body weight changes. So just before I conclude this video, I just wanted to highlight the fact that the positive results of this particular study sounds very hopeful, at least because given the fact that 25% of this world's population is actually silently dealing with fatty liver disease, which has no cure at this moment. That is an estimated 2 billion people living in this world that this drug can potentially be a cure of fatty liver disease. Now, while this new drug sounds very promising, it is still very important to maintain what you had been doing before. So you have to still lose weight. You still have to maintain healthy diet. You still have to cut down on refined carbohydrates. You still have to minimize sugary beverages. Try to incorporate more antioxidants and high fiber in your diet, because that helps in cutting down the excess fat in the liver. And last but not least, try to incorporate moderate exercise into your daily routine. So at least 150 minutes a week, which is the general guideline recommended by doctors. If you have any queries, questions, or concerns, I'll be very happy to address them. You can either connect with me in the comment section over here, or you can follow me on my blog and connect with me on social media. I am available on Facebook, Twitter, and Instagram. So I will see you in my next video. Till then, towards your health and happiness, this is Dr. Aastha Visen.